Good afternoon, and what a morning we have had so far. Thank you for taking the time to join us this afternoon in this panel session to discuss the important question of why we do what we do. We've hopefully put together a wonderful panel which will have some very inspirational topics to cover. This will be an hour session. If you have questions during the session, please just type them into the question box and I'll do my best to ask them as we go through. But first of all, let me introduce you to our wonderful panel. First up, we have a very old friend of ours, Professor Glenn Marshall. He received funding from us back in 91 and 1994 when Cure Cancer was the Leo and Jenny Leukemia and Cancer Foundation. Glenn is a leading paediatric haematologist and oncologist at the Kids Cancer Centre at the Sydney Children's Hospital. He's also Professor of Paediatrics at University of New South Wales. He's the head of molecular carcinogenesis program and translational research at the Children's Cancer Institute, and also the director of the Kids Cancer Alliance at the Cancer Institute of New South Wales. So please give us a warm welcome for Glenn Marshall. Lots of virtual clapping. Welcome, Glenn. Second up, we have Dr. Orazio Vittorio, who is also an old friend of ours. He is a current Cure Cancer grant recipient and has also been a past Cure Cancer grant recipient. And he's also based at the Children's Cancer Institute and the Lowy Cancer Research Centre at UNSW. And Orazio's breakthrough research focuses on the development of new treatments for childhood neuroblastoma and glioblastoma. So big warm welcome to you as well, Orazio. Next, I'd like to introduce Courtney Baglin. Courtney is a clinical psychologist whose little boy Alex is currently undergoing treatment for a rare and aggressive form of rhabdomyosarcoma. This is a cancer which forms in the muscle tissue, and we very much look forward to hearing how little Alex is going shortly on. But welcome to you, Courtney. It's great to have you here too. And finally, we have Joel Rennie. Joel is the founder and director of Generosity. Generosity is an Australian-based charity where 100% of the money raised goes to support the cause. And Generosity is basically a platform that allows people to stream and host live streams to raise funds for their charities. Through Joel and his team's efforts, they've had 3 live streams for Cure Cancer over the last year and have raised over $100,000 to support cancer research, which is a wonderful achievement. So Joel, it's wonderful to have you here as well. Welcome. So let's kick off. Glenn and Orazio, I think I'll start with you today. The conversation is all about why we do what we do. Could you tell us a little more about what inspired you both to go into a career in cancer research and specifically childhood cancer research?
You can go first, Orazio.
Glenn, I give you the honor to start. No?
You go. Hello. Oh, yeah, no, I've sorted it out. Yeah.
I think he has his microphone on. Still on.
I'm just on. I'll see that.
Right. Okay. Thank you. So thanks everyone, and thank you very much for inviting me here. So the question is why we do what what we're doing, and it's actually a privilege to be a cancer researcher for me, because I'm a cancer survivor too. So the major goal is try to cure this devastating disease, which is cancer. In particular, as a cancer survivor and a father of 3 kids, my dream is that one day the kids who get cancer can be cured, and the therapies that they're going to receive are going to be targeted in the sense that they don't have to suffer of all these side effects after the treatments.
Thank you, Orazio. Professor Marshall, what took you into cancer research and specifically childhood cancer research?
I suppose a couple of things. I worked with some very inspirational clinicians and scientists early in my career, and second, the opportunity. So that back in the 80s and early 90s, there was a huge period of discovery about the genetic basis of human cancer, and that really intrigued me and sort of dragged me along. And then, having re-educated myself in molecular and cellular biology, felt I could use my clinical knowledge to form translational questions in research that took clinical observations into the lab, look for people, you know, either that I collaborated with or our own lab, and then went to implement or take that discovery back into the clinic after multiple proofs. So it's probably, you know, the direct answer to your question is being inspired by kind of professional people. But I'll also hasten to add, once you start doing clinical work in our field, it's truly inspiring working with children and parents, and particularly the parents. That's what gets me out of bed every day. They're just amazing. The will to support their child and willingness to undergo what is pretty severe hardship. So that's probably enough of an answer, I guess.
Oh, it absolutely is, isn't it? And Professor Marshall, you've had a very established career with significant achievement. What would you say is the result of the piece of research that you're most proud of throughout your career?
Could I go back to your first question, because I didn't get a chance to address that, and I just need to have a shout out to you guys. You know, I got my very first small grant, I think it was $50,000, when I just got back from the US in 91, 92. And then I think that Jenny and Leo funded me the next year, and I was invited to speak at a function and met a lot of the people at the Boulevard. And I still remember that night, very nervous. And but it was so critical in a career of a young scientist, because you can't get funding until you have data, and you can't get data until you get funding. And so what you absolutely need is the support of groups such as yours. And I think I said to Vanessa that through email that I, you know, just couldn't be more grateful for the kick along and that really critical support. Orazio could probably also speak to, you know, and other scientists about how it's not getting your first grant, it's actually the second grant that's the hardest. And, you know, because you're basically up against the big guys at that stage. So, yeah. Sorry, I haven't really answered your question. Discovery-wise, I mean, been fortunate to be involved with a bunch of stuff, but probably two things stick out. One of them was sort of largely discovering the application of a genetic test that fingerprints minimal residual leukemia in children being treated for leukemia. So with Murray Norris and Michelle Haber, published extensively, and then so we made the observation in the clinic that this was needed. You know, a genetic, technology came along where it seemed possible to apply this. And I remember mentioning it to Murray when he came and visited me in the United States in 1988, and he fell asleep because he'd just gotten off a plane. And I thought, oh God, you know, this idea is terrible. But we eventually got funded, and then basically the rest is sort of history. We took he modified a lot of the technology. We then went and did a clinical study where we tried to evaluate whether children who had more leukemia at various points in their treatment did worse, and they did. And then with colleagues at Westmead, Luch Della Pausa being prominent among them, we designed a clinical treatment, including bone marrow transplant, for children who had the highest MRD level, the highest risk. And that study clearly proved that we doubled the cure rate for that group of children. So that was an international study at about 1,000 kids, and there were about 100 high-risk patients. So I feel very proud of that. And then the second is just our recent precision medicine program. So Michelle, the Zero program, and you may know about that. It really is essentially just using genetic tests of the child's cancer and growing the cells from the cancer in the laboratory to set them against drugs and try and give the treating oncologist a better idea of a match between a target in the cancer, the driver gene, and a drug. And so we Michelle and I started that. I told her she was crazy and it never worked. That's about 6 or 7 years ago. And it's a small industry now. We have a national and international trials and collaborators, and recently had a paper in one of the major journals and have many others. So that's gone from strength to strength. Yeah. But in both cases, we aren't there yet. You know, I think that's another important thing about scientists. You have to, you know, you talk occasionally to journalists and they say to you, well, it's all solved now. Is it now conventional treatment? And in children's cancer, most children are actually on trials. And so the trial system never stops until we get 100% cure and the side effects that affect those children later in life are minimised. So there are two problems not faced in adult cancer that you see in childhood cancer that are a little bit different.
Yeah, look, and the Zero project is really a remarkable project. I've seen a couple of the kids going through that and the successes you're having there. So congratulations to the whole team on that. Orazio, over to you. Obviously, you've had some significant press recently with your breakthroughs in childhood brain cancer, neuroblastoma and glioblastoma research. Would you like to give the viewers a little bit of background on what you're doing and why at the moment?
Yeah, and it's nice to hear from Glenn as well that when I started with his idea about the MRT, you know, people were thinking that he was crazy, because when I was starting talking about how copper, this metal, was important to support the cancer grow and spread in these pediatric tumors, people were thinking like, no, it's not gonna work. It's just a metal, you know. It's you're gonna really invest all your time in these. And the connection with the, you know, the tumor, the environment. So, but at the end, what you need to follow, and my supervisor in Scotland used to tell me, follow the weird results, and you will find the science, which is true. It's actually, when you want to find something new, you actually have to follow something which is really strange. And the breakthrough we found was that actually copper was feeding these tumors and was helping the tumor to grow faster, spread, and hide from the immune system, which was completely unknown before in neuroblastoma. So it's great to, you know, come across this discovery, but also very difficult to get funded. And here is where you know, you guys, Cure Cancer has been fantastic, because in the time when a young researcher feel like lonely and feel like, oh, it's impossible that I can go ahead with this project, you jump on, and you actually, with me, about 4 years ago, when I got funded the first time, you just funded my project before I was giving up science. I was thinking like, if I can go ahead with this project, I think science is not for me, I'm gonna give up. And then from there, it was everything, you know, followed the project. You know, you give me the possibility to create a team, which is fantastic, and mentoring the new young researcher. So it's really key, the support for a young scientist in new project, because they're both risky. Who is going to invest in such a risky project? Young investigator, no one knows him or her, and a very innovative project. It's very risky, and it's very brave and good that we have Cure Cancer helping us in this sense.
Lovely, thank you. And we also have to thank Sydney Airport, who were the major fundraisers for your first two grants as well. I know, speaking to their CEO, Jeff, recently, obviously they're going through difficult times at the moment, but they're very proud of what their funding has helped you achieve so far as well. So thank you both. Courtney, you are the mother of two beautiful young sons. Unfortunately, Alex is going through treatment at the moment. Do you want to talk a little bit, as far as you're comfortable, about what Alex is going through?
Yeah, thank you. Thanks for having me. So in October last year, I noticed a small lump on Alex's right thigh. And I thought, oh, that feels a bit unusual. So I went to our GP just to get it checked out, and he referred us on for an ultrasound and also referred us to see an orthopedic surgeon. And that surgeon wanted to do an MRI, which came back inconclusive. So we ended up doing a biopsy, and yeah, the very next day he contacted me and said, unfortunately, the lump is actually a soft tissue tumor, which is called rhabdomyosarcoma. And Alex has the, hopefully this is the right, I've got it correct, it's the ARMS subtype, which is the more aggressive tumor. He also had a sentinel node biopsy completed, and that showed that there had been some spread of cancer cells to the lymph node in the femoral part of his leg. So we were immediately referred on to the Children's Cancer Centre at the Royal Children's Hospital, and we started our treatment in December.
Tough times, obviously made a bit tougher with the impact of COVID as well.
Yeah.
How have you been dealing with that?
Look, the treatment itself has been really challenging. So Alex has had, the last 6 months have been really intense. He's had 9 cycles of chemotherapy. He's had 4.5 weeks of daily radiation. He's had surgery to remove the tumor. So he's had a lot. He's experienced quite a lot of physical side effects as well from his treatment. A lot of common side effects, nausea, vomiting, hair loss, that kind of thing. We've also had some other side effects which are a bit, I guess, uncommon. He also had a neurotoxic reaction to one of the chemotherapy drugs, which resulted in a seizure. So that was quite scary for us. So yeah, and going through all of this during COVID has been hard in a sense that normally it's only one parent that's able to attend appointments with Alex, and yeah, it can be quite exhausting, I guess, just tag teaming between myself and my husband as to who's going to go and watch our other son, and yeah, try to work and continue with our life, as best we can.
Yeah, look, it's difficult in normal circumstances, isn't it? But it's just been made that much harder, and I know a lot of the researchers here will say the same as well. So what's your hopes for the future? How is Alex doing now, and where would you like to be in the next year or so?
Look, Alex is doing really well at the moment. He's a super resilient kid. He's bounced back really well from his surgery. So physically, he's really active again. And just in the last few weeks, he finished his last cycle of chemotherapy 3 weeks ago. So we've just completed all of the scans again, and we're just waiting for the results. So we're just trying to keep really positive that we get some good results and that he can move to the next phase of his treatment, which is a maintenance chemotherapy. So it's low dose. It would mean that he could, somewhat resume a normal life again, get back to school and just reconnect with his friends. So that's what we're really hoping for. But yeah, we're just blown away by him. He's amazing. He's handled things so well, and we just hope that we get some good news.
Yeah, absolutely. And I've not met Alex personally, but he's been on TV for us and done a few other things. And the energy he exudes is absolutely fabulous. So he is a gorgeous boy, isn't he? And we have here amongst our researchers a lot of clinicians as well. If you have a message to them, because obviously you're dealing with clinicians at the moment, what's your feedback to those to do both research and clinical studies?
When I was thinking about, what impact research has had on us, there's no part of this journey where, I couldn't think of an example where we haven't been impacted by research in terms of, our treating team being able to identify, his cancer, the type of tumor, the degree of spread, that's all, informed his treatment protocol. Our doctors have always, reassured us that everything that they are doing, even though it's very challenging and very debilitating, it's well documented. There's good evidence for what they're doing. So obviously, that's really reassuring for us as parents. And it just kind of highlights to me the importance of, you know, you know, ongoing research, you know, improving the outcomes for children like Alex, you know, improving prognosis, because that's what helps us to keep positive, a sense of hope that things, you know, can improve. So, you know, as funding, you know, as, you know, your organization, you know, supports all these innovative ideas and early career research is something that, you know, needs to continue so that, you know, there's a better outlook for children in the future.
Yeah, absolutely. And Glenn, you talked just now about how rewarding that clinical work is. I mean, this is a very good example of why you do what you do ultimately, isn't it?
Yeah, I mean, I think that treating children for cancer also carries for the clinician the burden of, you want your patient to live another 80 years. And so we have long-term follow-up clinics and things, but really we expect that the treatments we give will not impact too heavily on the life of the child. And so there's sort of a balance often, which Courtney will have had from her doctors, where decision-making is around trying to improve. The cure is not everything, you know, it is, but in addition, you have to make sure that the side effects are less than are going to put a burden on the child later in life.
Yeah, absolutely. I'm just going to take this point now to remind people, if they do have questions, just to pop them in the chat, and I'll be able to filter those as they come through. Thank you. At this point, I'll bring in Joel. Joel, you've raised a phenomenal $100,000, which is a year of research. In the last year, it really is phenomenal through generosity. As Courtney has just alluded to, funding for researchers and is vitally important. What prompted you to become involved with Cure Cancer?
So, hello everyone. I really hope you can hear me as well.
Yes.
Excellent. I just thought I would take a quick second. I'm actually nervous. I've talked in front of hundreds of people, in front of tens of thousands of people live streaming, but all these great minds, all these intelligent people who are passionate, working on research, working in clinics, doing all of this, like, very often just really hard work, I'm nervous, which is so silly. But what started Generosity was, the best way to summarize it was like a bit of an existential crisis, I would say, when I was working in corporate IT for real estate. And I would work so hard, and I would look around every day and be like, I'm just kind of helping real estate, which is not saying anything bad about real estate, but more the fact that I had the skill set that I wanted to make a change, or I wanted to help people out there in the world. And I couldn't find a way to do that. And so when Generosity started, it was an idea that there are so many people out there who want to help and want to make a change in the world, that they've just happened into a skill set that not a scientist or a clinician or a researcher who would want to make a change. And so even as an example, we have someone who does masonry who came to us saying, I can make an arch out of stone. Can I help? And so another segment for one of our shows is going to be us intertwining what he does to make stonework. But so what drove the start of Generosity was to just try and make a change in the world. And it's so nice to be here talking to everyone. It's like seeing everyone hearing all of this, because it's looking for people in the world who want to see this world be a better place. And cancer is terrible. It's one of those things where it's one of the things in the world that everyone can agree on, is that cancer is a terrible thing, and it happens irrespective. It doesn't matter who it is. It can just happen at different ages to different people, and it's so unfair. And so Cure Cancer are amazing. I don't know if you can tell I'm nervous.
No, you're doing fine. Don't give it away.
All right, good. Cool.
Great job. So Generosity have raised $100,000 for us so far, which is mind-blowing. What's your hope for the future, particularly along the cancer research, please?
My hope, like hearing these stories, like going to the Governor General's place a year ago, feels like so long ago, but hearing that money, that funding is going to people, like hearing all the stories just from, I'm going to not get the pronunciation right, and I just had him up on the screen, and Zerio, nope, I'm looking for him in the chat. He might have dropped out.
Yeah.
Orazio, there you are. I'm looking, Orazio. I'm like, oh, didn't it start with that? Hearing your story about how you were saying, I had this, I had these ideas, and without that funding, it would have never happened. That's something that we want to do with Generosity, is that this is an amazing cause, and it creates that funding to allow people to actually research into different fields and different directions and try things out with the safety of knowing that they have the funding to do that and pursue that. Mm-hmm. So our aim for Generosity, I've always said this dumb tagline of bigger and better, but it's always been kind of driven by the idea of like, I'm getting all my quotes wrong, but it's like the like pure altruism, as in the idea of trying to use as little money as we can and raise as much money as we can to make as much change as possible. Yeah. So I think over the coming years, it's to just grow and get like bigger, longer, more people onto the show and raise more money, ultimately to raise more money and make people laugh, which is, I love it. And then Nikki watched our first stream, and we actually all got so worried when we saw Nikki show up, saying Nikki was laughing, and we were like, the CEO of Cure Cancer is watching us, like singing on a balcony, playing pots and pans from a Airbnb kitchen. It was such a
but it worked. You raised about $1,000 through that, so it's oh, thank you. So talking about where that money goes, Orazio, we obviously are funding you at the moment. We're raising $90,000 for you to take your theory, or your copper chelation theory, to clinical trial. Do you want to give everyone a bit of an update on how you're going with that current research?
So basically things are going pretty well, in the sense that we had very good data in the lab. So in the experiments we had in animal models and in vitro, and we also had some analysis of some patients, and where we saw that those patients actually have high level of copper, and then unfortunately when they tumor progress, the copper is going to go higher. So we have some very good confirmations. So, and it's going very well because the drug that we use to remove copper from the tumor was approved in Australia to be used clinically 1 month ago. And this opened a great hope for us to basically write down a protocol of clinical trials for this kind of tumors, which are neuroblastoma and glioma. So currently we are working to get more data to satisfy the human ethics and write a proper protocol to start a phase 1 trial next year. But in the meantime, we have been in touch with the group in US who is doing a similar things in breast cancer, and their data are amazing. They're already in clinical trial phase 3. So maybe we can, work with them and also bring this kind of protocol in Australia too for breast cancer too. So it's really exciting, and everything started from a young guy who had this idea, found something strange, and the support of Cure Cancer.
No, that's wonderful. So what is your hope for this clinical trial that's coming up? Is it to extend the life of children with glioma and neuroblastomas, or is it to cure them? What's the first level as you go?
Of course, my dream as a cancer researcher, father, cancer survivor, as a human being, it would be find the cure. One day, every one of us, everyone who is a researcher here, the big dream is you get your unfortunately your diagnosis, and you say, don't worry, you're not gonna die for it. You're gonna survive because we have a cure. This is our big dream, and every one of us here in this audience outside wants this. But in reality, what I would like to see with my drug is improve the survival, give at least more time. I don't know if I'm gonna cure, but giving at least more time for family and the patient to spend together in quality time. Because the good thing is that the type of drug we're using has very low side effects. So we hope that this can improve the quality of time. And in our animal model, double the life of the animals. So talking with some of my consumers, when I talk to them, some of them, they lost their kids, which is something terrible. The worst things can happen in the life, I think. They say, if I could have at least more time, if I could have at least 5 years instead of 1. So I would say that the tangible goal is improve survival and time, and also quality of life. And of course, in long term, every one of us, my colleague here, amazing, as well. They've been showing amazing data, amazing science on different types of tumors. Our goal is to find a cure that can manage any type of tumors. Like is what can I say? Like is a normal infection of a bacterial that we pick, we use antibiotics and we cure. This is the big dream. But in reality, we need to improve the life now and improve the time, the quality life that these patients can have with their families.
Yeah, look, it's really important. And, you talk about your copulation theory being translated into treating other types of cancer as well. Glenn, how important is translational research? I know many researchers here today are doing that currently.
Well, it is very important, but I would also have to caution you and say that it's extremely important. There are people doing more fundamental, basic cancer research as well, picking apart the cancer, figuring out how the molecules drive the cancer. We haven't, really touched the surface of a lot of that knowledge. Translational research is basically all that I do, or a lot of what I do, and it's essential as well. So there must be a bridge between the laboratory and the clinic. And what people like Orazio and I and our colleagues are doing, we've created a system where doctors and scientists are basically buddying up, and that is a way of accelerating translation, so that it's extremely important to have it done well. Otherwise, great discoveries that are basic science don't make it into the clinic. The literal answer to your question is it's essential, but it must be coupled with other things.
Yeah, thank you. So Orazio, just back to you, and something we touched on, we did a lab tour recently at UNSW with you and some other company CEOs, and one thing that shocked me when you talked about your day, as a member of the general public, you would like to think that researchers spend most of their time in the labs doing research, but sadly that's not really the case, is it?
No, it's not really the case. We spend time a lot writing grants because we need to support the research we do in the lab. Our consumables are the materials that we use day by day. It's very expensive, and all the genetic analysis we do are very expensive. So we need to apply for grants and try to find support from multiple sources to keep going our research. And the other thing is that there is a lot of paperwork, human ethics, animal ethics application, all this admin stuff that we need to work it out. Sometimes for writing a proper animal ethics application, it takes 1 week of work, for example. Writing papers as well is very important because we need to share the knowledge with our colleague. So it's not only about the lab, but also we have a lot of things to do, like in the office area.
Yes, and that's something that shocked me because as I know, a lot of researchers can spend 3 or 4 months applying for grants, and it's so vitally important that we can help fund not just Cure Cancer, but all organisations can help fund this research, because sadly, I think it's around 11% at the moment of early career cancer researchers get funded.
To give a number specifically, the year I got funded by Cure Cancer Australia, I applied for 8 different grants and I was successful only 1, yours. So I spent energy and time to apply for grants that I could spend more in the lab, yes, but it was worth it to try at least, what I could do.
Yeah, absolutely. So how can members of the general public help support researchers more? Open to Glenn or Orazio. What more can we do to assist you in securing funding for your research?
I mean, firstly, I feel that having the general public behind what I'm doing every day is incredibly helpful. So you get great momentum in your thinking and your work to know that the culture in our society thinks that doing these things is important. And there are lots of parts of the world where that's not the case. So sometimes I think it's just as important that, 10 people know as getting 10 times $1,000, in donations. So community awareness. But as I alluded earlier, it's impossible to get going in research as a young scientist without funding from an organisation such as yours, which is sort of favouring people, younger generation who have got really good ideas. So, so your funding stream complements a lot of the other governmental systems, which, as Orazio says, are very difficult and competitive to get into. And so I think the dollars is important, community awareness is important.
Right, thank you. Orazio,
Yeah, I agree. I agree with Glenn. And also, I can tell you that every time we take a lab tour, every time we have some guests in the lab and we talk to them, if you notice, I always bring with me some of the PhD students, some of the junior postdocs, because they need to know that behind every numbers that we look like in the lab, there are patients in there. There are patients who are waiting, who has hope, who are looking for, a cure or some help. So it's really important, this relationship between the community and us. We need to talk, because at the end of the day, we are in the same boat, and we want the same big goal. And in terms of psychological support for us is important, because we don't feel lonely. We don't feel like we are working for ourselves, because most of the time we don't have any window in the lab. We are us, the cancer cells, some mice, some tubes. Sometimes it's very frustrating, but feeling like, don't worry, there is someone there who is cheering you up because he needs you, she needs you. And it's really nice also from our point. And on top of that, advocating for young research, new funding, try to lobby the government, spread the voice that we are not monsters. We are scientists who wants, doing something good for the community, for everyone. It is really, really important.
Yeah, I absolutely. I think so. Obviously, I was at that lab tour that we just done with you before we got locked down, and the look on people's faces when they could stand in the lab and look at a tumor that's a 60-year-old tumor, and the treatment and the progress that you had, and feedback as well. And we can be strong advocates as much as we like, but quite frankly, people don't want to hear from me. They want to hear from the researchers and the scientists. And I would say this to any of the researchers here, that the more people, and I know it's difficult, and I know you have to organise it, the more people you can get in your lab and to see firsthand what you're doing, because they go back and they tell their companies and they go and tell their friends, etc. I think it's vitally important to be able to promote yourself that way as well. Courtney, Alex has been the face of our little buddy box and obviously a recipient of that. Did you want to talk to the audience a bit about the buddy box and what that meant for Alex?
Yeah, he was so excited when he got the buddy box. So it was just a really nice surprise for him and a beautiful gesture from Cure Cancer when he received the box. The treatments, as I said earlier, are so debilitating at times, and also really isolating. Alex has spent a lot of time just, either in hospital or at home, not being able to see, his friends or extended family, and, using a lot of screen time as well during his treatment. So the buddy box was like a really welcome gift where there was some really cool things in there for him to do. So some Lego and pencils and, the drink bottle that he still uses every day to remind him to always hydrate. So he loves that. So yeah, just a lot of really great things for kids to, give them a bit of a distraction from, the difficult hospital days, and also just to remind them of their strength, because I think there's a beautiful little card in there saying, I think it's you are strong or you are brave, and just having that affirmation was, really special for him. So, yeah.
And does Alex understand what's going on? Does he comprehend, or is it just a bit difficult for him at this stage?
No, he really does have, I'd say, a pretty good awareness of what's going on. We've always been pretty upfront, with him and pretty honest about, what's happening to him. you know, from the beginning, you know, when we found out that the lump was a tumor, he named his lump. He called it Bob. So we've all kind of been on a bit of a journey with Bob, and you know, he asks lots of questions about Bob, and you know, that his doctors have been amazing explaining to him the way in which chemotherapy and radiation, you know, change Bob. And you know, once he had the surgery, we, you know, he you know, we talked with him about donating his tumor to the tissue bank, and he was really proud of being able to do that. And he even understands that, you know, that's something that will, you know, enable, you know, I guess, support research around, you know, his type of cancer. So yeah, he's pretty aware of what's going on, and we're really proud of him for, you know, how well he's taken all of that on board.
Oh, bless Bob. That's gorgeous. But also your resilience as well. And Glenn, I'm sure you've seen this over your career, that you know, it's obviously difficult for Alex, but for Courtney and her husband and many families as well, dealing with a cancer diagnosis just doesn't affect the one person going through the treatment.
No, it's a big ripple effect throughout the community, as probably Courtney's seen. We've done a lot of research on grandparents, for instance, who in our world, of course, in Sydney, everyone has a mortgage, usually very large, and so both parents have got to keep working. And so the grandparents are the people who sit by the bed. And often they're a little distant from some of the discussions, and they go through some pretty tough times with, you know, no information, or at least not being in control. They kind of support people. And then the other group are the siblings. So we also have a research program around how to reduce the effect of cancerous treatment on the siblings of children affected by cancer. And we have thirdly, a wider program which I started up 2 years ago. It's a national network called Kids to Adults Alliance, and this is a survivorship sort of, if you like, through research. We will let children with all chronic illnesses, not just cancer, but other chronic illnesses, live their best lives through research. And so for me, a lot of these things dovetail into the very individual aspects of people's lives. If there was one sort of theme through my work, it would be individualisation of care. And care includes not just giving drugs in the clinic, which I do every day, but also individualising the diagnosis, individualising the therapy, which we do now in the Zero program, and now individualising the survivorship needs of the families. So it's, we've still got a long way to go, but I think we've made plenty of progress.
Yeah, no, absolutely. It's vitally important. And Courtney, I'm sure you would have felt that too. It's not just looking after Alex, but you know, you still have to care for his brother and kind of make it normal for him as well.
Yeah, absolutely. Yeah.
Very difficult. Joel, moving on to you. Part of what you do from a generosity perspective is raise awareness of cancer research in a field of gamers and streamers. For those of the people here that don't know what that is, do you want to explain about what your audience does and how important it is to get the message across to them as well?
It is a very silly audience in that I don't know who out there ever watches Twitch, specifically Twitch, but also YouTube, just the whole entertainment space. But it is really important as a place where people go there because they have free time, or a lot of the viewers will finish their day at work, or they're at work watching, or it's kids and students who have finished their day studying and they're at home watching, you know, on the internet. And there is so much content on the internet, but the question was kind of how to get people, how to entertain people, but also make people aware about things in life that are really important. And in this case, in so many ways with Cure Cancer, making people aware that they can donate. I guess it's the awareness part is the important part, but also the fact that if they have money, they can donate. But we also make sure that if someone has only $5, we're like, you don't have to donate. If you want to donate, you can. It's never a push to donate. It's this idea that we want people to donate if it's possible. But either way, just becoming aware of Cure Cancer and what Cure Cancer does in between very silly segments of, I'm trying so hard to make this sound far less silly than it is, but we have a lot of incentive goals where we will have buckets of slime where we pour them onto people's heads, and these like hot sauce randomizing wheels where we spin a wheel and people will eat just the hottest sauce you've ever. It's not a good idea. I don't suggest anyone does that, but yeah, it's a combination. We just want to make people laugh, make people have fun, because cancer is such a serious topic. But so it's a way that we can actually make people aware of cure cancer, make people aware that there are researchers out there that are actually working towards hopefully us being the last generation to have anyone die from cancer, and then but also bring happiness and bring smiles. So it gets very silly. It's actually, I started growing this beard purely as a donation goal. It's like a several year investment. So it's
but also, not only is it about putting smiles on people's faces, it's borderless as well. I mean, your network is global, so you're reaching out to people that have sadly all been part of or know someone that's suffered from cancer diagnosis too.
Yeah, it's true. It's so myself, I don't often talk about it, but my dad has had 2 types of cancer that he's been very lucky to have managed to catch in a way that he could have it removed. But us joining forces with Cure Cancer and raising money for Cure Cancer happened before that happened. So when we first started raising money, I only saw it as someone who didn't have it that close to me in the family. But it is, yeah, it is a terrible thing that the more people we make aware of it, the more money we can raise. It just feels like it feels like all the best parts together. Sorry, that wasn't the best answer, Nikki. I kind of went off on a.
No, that's fine. And you do have a new stream coming up for us later this year. So
Yes, we're going to be at PAX Australia in October, taking over the Wombat Theatre, and so it's a gaming convention. It's Australia's biggest gaming convention that has tens of thousands of people coming through the door every day, and we've had like Peter Hellier that was there once, and I only bring that up because I just remember Peter Hellier was there, but we have a lot of different celebrities, a lot of different guests come to the show, and we're going to be there running around making sure that we can make people laugh and hopefully raising as much money as we can for Cure Cancer.
Thank you, Joel. You live up to your name of generosity, and your audience absolutely is, so it's wonderful. Thank you for your support. We've just got a few more minutes, so if there's any other questions, I have one here for Glenn, but if anyone has any other questions, either pop your hands up and I'll come around to you, or please pop them in the question box. Glenn, one from Vicky Quisler, who you will know well, who has been a wonderful supporter right from the beginning with her family, and obviously remembers you from when you were funded. Her question is really about the Kids to Adults Alliance. Could you explain a bit more about that?
Oh, this is an attempt to improve the lives of children with chronic illness, so cancer being one of those, and really there we're talking about the side effects of the treatment of cancer, or cystic fibrosis, diabetes, anything like that. So there's currently about 1 million children in Australia who have a chronic illness, and depending on how you measure it, and their health, like with cancer, has benefited enormously from discovery science. So the problem, however, is that they have lots of health problems into adulthood and during childhood that prevent them going to school for the normal duration, and mental health problems are a great problem for any parent and child with chronic illness. And so what we're trying to do is not so much in survivorship invent a cure for survivorship. We're trying to, and this is really directly pertainable to adults or children with cancer, trying to improve the child life so that that child's trajectory in life is very close to a child who doesn't have cancer or a chronic illness. So there's a big gap currently. And so we are about 80 researchers, only 2 years, pulled together the initial group, and now grown to 80. We have about 20 to 40, depending on how you measure it, parents and not-for-profits involved. And our goal is through research to let them live their best lives. And it's happening. It's a lot of fun, I have to say.
Yeah, it would be. It's truly wonderful, isn't it? So thank you for being part of that. Orazio, over to you. Obviously, you're looking at your capitulation therapy at the moment, but what's your hopes for the future with your own research? What do you want to achieve?
So in the copulator, let's say, strainer research is not the only one we have. So we came across two other weird results, how we call it, we are following, especially for a tumor which is called the DPG, is a brain tumor that unfortunately is incurable. And my hope is, because in the DPG especially, the survival rate at 0, so no kids survive over 2 years. My big hope is to contribute to science and with fundamental science to help my friend Glenn and all the fantastic oncologists they are up there to improve the survival, especially for these rare diseases. But you know, when you have 0 survivor, it becomes a very huge problem.
Yes, we talked to Professor Phoebe Phillips about this recently with her clinical trial for pancreatic cancer. And she, one of the audience actually said to her, why hasn't pancreatic cancer, everyone's got a pancreas, why hasn't it got them as much publicity as per se breast cancer, for example? And she very simply said, well, there's very few survivors. And that's the reality of it, isn't it? So
yeah, and I think in terms of, you know, this kind of tumors like DPG, like pancreatic cancer, where you have 0 survivor, and in the last 30 years, we haven't seen any improvement. The only things that you can hope is that a really novel idea come in place to change, you know, the fate of the future of these patients. So again, it's really important having acute cancer, supporting new ideas coming from a young researcher that can maybe change the future of these terrible diseases where we have still 0 survivor, and even if we are able to send people to Mars.
That's the irony, isn't it? Send people to Mars, but we're treating people with cancer drugs from 40 years ago. So does anyone have any other questions before I wrap up with some last comments from the panel? Any questions? No, I can't see any hands. Okay, so let's just finalize things with a comment from each of the panel members. Joel, what's your hope for the future?
My hope is that I think with Cure Cancer supporting us, I feel like I should have put this a bit more in another answer they had. We are a very silly show, a collection of people all working for free, all volunteers, like raising money. And by Cure Cancer supporting us, it helps legitimize us to actually grow and be bigger and to actually get out there with the message that we have, because we truly are so silly, and Cure Cancer is such an amazing organization. So I think my hopes are to essentially just keep going and get bigger. And I know this sounds like such a kind of a reductive sentence, but it's seeing where the funding that we're able to raise, seeing it go to researchers and hearing all these stories, like everyone in here today, it's a collection of people who can't get into a lab, who don't have, like myself, I wish I could be a researcher. I wish I had the attention span. I'm very much just a adult ADHD silly person. And, but it's the fact that I can use what I have to help raise money and to help you guys do what you're doing, because it is so impressive. And that's why I was nervous talking today. So my hopes are keep going.
No, you're very good at talking. I've seen you at 1 o'clock in the morning. And Orazio has just invited you to come to the lab. So we will, when we get out of lockdown.
I wrote that down during this whole thing. I was like, I want to go to that lab. That would be amazing. And if we can bring cameras.
I promise I have a very good coffee Italian machine in my office. Okay.
That's perfect.
Thank you, Joel. Courtney, over to you. What are your hopes for the future?
Oh, look, I think everything that Joel just said is everything that, I would also hope for. I guess I have that lived experience of as a parent of a child, and it is quite an unbearable journey to go through. And I think that, you know, the research and future research, and knowing that, you know, things can improve and that we may be able to find a cure one day, gives us, you know, me as a parent, hope. And I feel like hope is honestly just the most important thing that you can have when you're going through this journey. So yeah, that's what I would hope for.
Thank you. Powerful words, and thank you for sharing your story. You do
Thank
it frequently for us, and I know it's difficult, but send our love to little Alex and his family.
Thank you.
Well, thank you. Orazio, well, what's your hope for the future of cancer research?
My hope is that we can continue to make discoveries, and the discoveries can help realistically the patients to live longer and live better. And the big dream is, you know, because I am a cancer survivor, and I went 10 years follow-up, which means like here, you go in front the CT scan room machine, you look at that and say, oh, it's gonna come back. How I'm gonna survive. I hope that one day, every single patient goes in that room, and if the cancer come back, the clinician can tell, don't worry, we have a cure. This is the big dream.
Yeah, wouldn't that be phenomenal? And also just a reminder that because the cancer's gone away, it doesn't mean it won't come back, and you're living with that from a permanent shadow, aren't you? So thank you for sharing that, Orazio. And Professor Marshall, to finish with you, what's your hope for the future?
Oh, well, we two things that we work on at the moment, I hope, come to fruition, and I get to the point 100% of my patients are cured. One of them is using single cell analysis to tell us what the composition of the tumour is before treatment and after treatment, and that hopefully will tell us who's going to relapse, and not only that, how we should treat them. And then the second is that half of all child cancer begins in the womb, and so we work on preventing child cancer by better understanding the genes that drive it in the womb, and also potential environmental factors. So if we're right about those things, prevention would be much better than cure. So I hope that in the not too distant future, we have a 100% cure rate with healthy children and happy families.
And cheers to that, don't we all? Thank you, Glenn. So that will finalize our session today. So if you could put your hands or your virtual hands together and give a big round of applause for Joel, Courtney, Orazio, and for Glenn. Thank you so much for sharing your thoughts and your insights. I hope you all found that informative. So that's it. So to wrap up, thank you all, both public and our alumni, past and present, for being here today. Thank you for the Research Consultative Committee for all of your efforts for putting this together. It is by no small feat to have this done. It's the second year we've done it virtually. It is challenging keeping people engaged online for a whole day, but I hope you as researchers and scientists have found this interesting, not only to learn from Joe about professional development, but also from your fellow scientists. My hope is that you continue to collaborate with each other. I know many of you know each other and have started to work together because of your network with Cure Cancer. And that's my hope for the future, more collaborations and better results for cancer research. Thank you, Vanessa, very much. You have had many sleepless nights and worked incredibly hard in putting this together. Really do appreciate it. Thank you to all our donors, our funding partners, for coming along. And one closing comment, remember to follow the weird results. They get you the answers. Thank you, Orazio, for that takeaway. So with that, I say goodbye. Thank you. We will have some publications, some recordings, some snippets going out on social media. Please feel free to share yours as well. And if you have any questions, just drop Vanessa or myself a line afterwards. So thank you and have a good afternoon.